This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And at Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
Dr. Salih, our topic today is on plastic surgery.
A lot of times I get asked the question that, where does the word plastic come from?
The fact is, there is much more to this particular field.
I did plastic surgery because
Plastic surgery is a field that intrigues a lot of people. While some think plastic surgery is just about getting nose jobs or facelifts, the fact is there is much more to this particular field. I'm Dr.khawla, and we have dedicated this particular episode to learning more about plastic surgery. Dr. Salih, our topic today is on plastic surgery, and I think a lot of people who are listening think of plastic surgery as just cosmetic surgery. Can you talk to us a little bit about that?
Absolutely. That's one of the very common things that I come across. People quite don't understand the difference, or let's say the fact that cosmetic is one part of plastic surgery. So to start from the beginning, I would say, a lot of times I get asked the question that, where does the word plastic come from?
Yeah.
Well, it has nothing to do with plastic
Okay.
in the common
Good to
sense
know.
that we know. It comes from the Greek word plastikos, which means to mold or to create. So that's essentially what we're doing here. And broadly speaking, plastic surgery has two main divisions: reconstructive surgery and aesthetic or cosmetic surgery. Now, reconstructive surgery is a big thing. It has a lot of other things underneath it. For example, microsurgery, reimplanting digits, even limbs, face transplants, which we know about now. All that is part of microsurgery. We have maxillofacial surgery, which we do a lot of. It's an overlap territory from the dental specialty as well. Then we have hand surgery below the level of the wrist, which a lot of plastic surgeons do. Of course, well-known burns and other forms of trauma corrections as well.
So these are not really cosmetic, right? These
Not
are
at all.
sometimes
Yeah.
life-saving surgeries.
Absolutely, they're emergency surgeries, and in many cases, life-saving surgeries, as you said. Cosmetic aesthetic also has a lot of benefits, which we'll talk about later. It's not just vanity that we're correcting or pandering to. It's much more than that.
We commonly think of women as the main seekers of plastic surgery, but it seems like men also come for
Absolutely.
getting
Though
plastics.
the majority of patients are female, but it's a global trend that more and more male patients are going in for aesthetic surgery as well, and it's a trend which Bahrain is part of.
I heard, Dr. Salih, you have a brilliant collection of before and after pictures for some cosmetic surgeries.
Well, I have a few.
Do you mind showing us a few results?
Sure, absolutely. So, if we talk about a typical male patient here, so what this patient has had is certain changes that have come with weight loss. In fact, actually, he was much bigger than this before. So what that induces is that you get loose skin on the abdomen as well as on the chest. He still has fat pockets, irregular fat pockets left on the trunk. So what he underwent this surgical correction in 2 stages. So what we did first was a very good liposuction of the chest and the abdomen, and later on followed by a tummy tuck. So this patient is a great example of how a surgery like this can improve self-esteem,
Yes.
as well as induce a sense of positive body image. And as you can see, the guy is much fitter in the other photograph, because once he had all this corrected, he wasn't conscious about working out in the gym. He felt motivated to do and further himself, and really he became much fitter version of himself.
All of these changes with dramatic weight loss we see in clinic a lot after bariatric surgery.
That's true, absolutely.
And I think that's one of the reasons why people are scared of getting bariatric surgery. But to be able to see such nice results is
exactly, and
promising.
that's something which I didn't quite touch upon earlier. We're getting more and more patients post-bariatric weight loss as well. So it's post-massive weight loss after bariatric surgery, and they need, a full body reconstruction or contouring in many ways. So we're looking at facelifts, chest, abdomen, arms, and thighs. So and sometimes a 360 lift, where you take an incision all the way around. So what you're doing is a tummy tuck in front and a buttock lift at the back, in order to get rid of all the loose skin and fat that they have.
Interesting. So what is the time frame, Dr. Salil, between these 2 pictures?
These 2 pictures, this is at the end of about 10 to 11 months.
Wow.
Yeah.
Very short period.
Very short period. So you can see it's a very good recovery, and how he's got fitter actually because of his effort.
Are these procedures safe? I think that's what concerns a lot of people.
They're absolutely safe. And in surgery there can be nothing which is 100% safe, but how you prepare for things, So we take great care in seeing that we do a very thorough pre-op assessment of the patient. If there are anything that has to be corrected, we do that beforehand. Once the patient is fit for surgery, he's good to go. So it's all about the place that you work in, what safety protocols you follow, how you manage patients pre-op and post-op, and all these things usually result in good results, which are safe. So Dr. Khawla, we have actually a patient coming in today who's had some surgeries, and she's been kind enough to, talk to us for a while. So I'll just call her then, yeah? Yes, Lily, you can get the patient.
Hey, doctor.
Hi, Angela.
Hi.
Angela, how are you?
I'm doing good. How are you?
Good, good. Thanks for accommodating us today.
Oh, no problem. It's my pleasure.
Tell us, Dr. Salil, what type of procedure did Angela have, and
Yes.
what was her journey like?
Angela had the typical changes that that happened with pregnancy, and a little bit of weight loss, I think, as well. So essentially, although having a child is a very rewarding experience, but
Congrats.
but it does have certain changes that happen on the body.
Sounds great. So, Angela, talk to us about your experience.
Well, my experience, trust me, it was amazing. I met with doctor about a few times before I actually made my decision, and I am glad I made it. We went to surgery. It was a long surgery. And I came out, of course, like with every surgery, a little bit of pain, things like that. But I'm telling you, like a few hours after, I felt a lot better. He was very attentive. Every little thing that I was like, oh my God, this is wrong. He was right there holding my hand all the way. I love the results afterwards, even like 2 weeks. When all the swelling started coming down with the liposuction and stuff, and I was like amazed. I was like, oh my God.
I mean, a lot of women, I think, Angela, here in Bahrain in particular, after multiple pregnancies, like Dr. Salil mentioned, do suffer from, redundant skin, really having trouble losing the weight and just going back to the way they were. So what is your advice or message to those girls or women who are struggling with exercise and training but not achieving the right results?
Well, one, I say don't stop exercising. That's the best you could do. Two is go for it. Don't let anybody tell you this is plastic surgery or doing contouring is bad for you. No, just do it. Like, if you want to feel better about yourself and that's the way you need to feel better about yourself, go ahead and do it. Don't let no one
I think that's a powerful message, is do it for yourself, for your own self-esteem. Don't do it for other people.
That's what it's all about, actually. It's not about vanity, it's about your body image. And having a positive body image results in, benefits not just in personal life, in professional life, and overall, people, it's in the mind.
Wonderful. Thank you, Dr. Salil, and thank you, Angela, for having us today.
Thank you.
Appreciate it.
Well, I did plastic surgery because, one, I have two kids. I have a 15-year-old and I have a 10-year-old. And well, as being a mother, they left me with stretch marks. And my stomach was where it wasn't supposed to be. You know what I mean? I had extra skin. I tried dieting, I've tried exercising, and I couldn't get rid of it. I am from America, so I looked over there as well for doctors, and I didn't technically like them. Found Dr. Salil. He is a little conservative, and that's what I like about him. He doesn't go to the extreme that other doctors do and try to shape you, because I'm a bodybuilder, so I need to shape myself. And without the plastic surgery that I did a tummy tuck and liposuction. So without those, I wasn't going to be able to get the shape of body that I wanted.
There are numerous myths that go around regarding plastic surgery. Today we address 3 of those major myths. Myth number 1, plastic surgeries are all cosmetic in nature. Now, while some plastic surgeries are in fact cosmetic procedures or surgeries, there are other branches of plastic surgeries that include reconstructive surgeries that are used to restore the normal appearance of a body part. These are usually utilized for correction of birth defects, scar revision surgeries, amongst many others. Myth number 2, the results of plastic surgery are lifelong. Now, the fact is, while plastic surgery can give you many years of satisfactory results, the results are not lifelong, and they depend on many patient factors. Myth number 3, a single plastic surgery procedure is going to be performed with the same technique in the same way by any plastic surgeon. The fact is, every plastic surgeon out there has their own technique, skill, and level of expertise. Therefore, it is really important for you to be comfortable with the level of skill and expertise of your surgeon of choice. Hi, hello.
Hello, Amira, how are you?
Hi, doctor.
So, Dr. Salil, walk us through some of the procedures that you have done, cosmetic procedures of the face.
Absolutely. So we have Amira here today, and she's one of our regular patients. So I'm just going to use her to demonstrate some of the procedures that we do for, especially the face. So as you know, there are surgical and non-surgical procedures that can be done. So we'll just go through briefly some of the common ones. Okay. So this is a patient, actually, it's very obvious that he's had a rhinoplasty.
Very obvious.
So it's a significant change. He was unhappy with the breadth of his nose, as well as the poor definition that he had of the tip and the dorsum. So you can see that there's a significant change that has happened. And from below, you can see the worm's eye view, as we call it, the literal change with the extreme flaring of the nostrils that he had as well. And this is a much more aesthetic triangle that we try to create in patients. And similarly, for female patients as well, you can see that this is an irregularly shaped nose, which has then been symmetricized. And that tiny incision, this is a very early photograph, so you can see it, but it just disappears in a few weeks after that. So this is rhinoplasty here. Then again, this is something we do quite commonly as well. If you see, there are certain changes that happen with aging as well as gravity. So the skin around the eyes becomes loose. So she has upper and lower loose skin on the eyelids. There's a little bit of fat herniation also which is present. And this is post-op result. So again, late result, you can't see the scars which are just underneath the eyelashes here and in the skin crease above. And it looks really nice.
So these are all one-step surgeries, right?
These are one-step surgeries. I mean, both of these, I mean, this would be a one day in the hospital. Potentially patient can go home the same day, but we just prefer to have them overnight. So this is a blepharoplasty, and so we'll just take Amira's permission. So she's beautiful, she doesn't need it, but it's just in case there is more loose skin here. So what we're trying to do is we're just trying to raise it up so that the lines and the sagginess goes away here. And the upper eyelid as well, if you could just close your eyes for a minute. Basically, she has no loose skin, but this is the area where the skin becomes loose for patients with.
Can you show us also where the incisions would be for a facelift or for a blepharoplasty?
So yes, for a facelift, the incisions actually go around the ear here. It goes onto the hairline a little bit, and then skirts the border of the ear and can extend backwards on the ear as well. But that's the only incision. So, would you like me to show you a little bit about the facelift?
Let's take a look.
Yeah. So this is a typical patient for a facelift. You see that there's sagging on the sides. There's a fold which is becoming prominent here, and also loose skin underneath the eyelids. So this is the same patient after the surgery. Everything has been lifted up and has a much more V profile that we try to recreate. With aging, you get more and more of a square profile, which has to be lifted up. So then again, this is a good photograph. You can see the jawline, how nicely it's enhanced, and the whole thing has been lifted up. So all the sagginess here is gone. And as far as the incision goes, you can see that this is just 4 weeks later. You can hardly see the incision line on the side of the ear. And again, the facelift also addresses the loose skin that can develop in the lower face. So with this lifted, everything in position, this is treated as well as the mid face and the upper face also. This is again the incision which is healing nicely.
We hear a lot, Dr. Salil, that there are certain things that we should do even in our 30s and 40s to prevent sagging from occurring or wrinkles or lines. So what kind of procedures can help with those?
That's right. So, I mean, for everybody, this goes without fail. I mean, you have to take care of your skin as well as, the structure of the face. So some useful tips would be, prevent yourself from overexposure in the sun. If you are going to be in the sun for a longer period, use good quality sunblock. In this part of the world, something with an SPF 50 is minimum that you should be using. Your daily skin cleansing routine is very important. You should moisturize your skin and remove all cosmetics and other things before you go to sleep.
Dr. Salil, can you show us some pictures or examples of fillers and Botox use?
Sure. So as you said, Botox and fillers are some of the commonest procedures that we do in the outpatient. And I'll just demonstrate on Amira a little bit. Yeah. So Amira, if you could just look up with your brows up. Yes. So you see here, she hardly has any, but you can see that the lines come on there.
Yes.
Right? And also if you can try and be angry, Amira, I know you never are, but yeah. So she doesn't have much either, but you can see these lines developing. In some people, they get quite deep. They're known as the 11s, And of course, a broad smile, if you can do a grin, a big broad smile. Well, she has nothing here, but then you develop these lines here, which are known as the crow's feet. So these are some of the things that we treat with Botox. There are some other indications for Botox as well on the lower face. Sometimes you have a downturned smile, which you can bring up with Botox as well. But essentially, what we're doing is we're injecting minimal doses of Botox into the muscles that cause these movements. So Botox per se does nothing to the skin. What it does is it acts on the muscle underneath, which is causing the skin to wrinkle. The wrinkling is not very apparent in younger age, but as we all advance in age, the skin is not as supple as it used to be, and the gravity takes over as well. So a combination of these things causes wrinkling to happen. So if you selectively block the muscle action without freezing the face, and that is important because you don't want to create a mask-like face with no movement. You want to give just the right amount so that those muscle movements are limited and therefore the wrinkling is limited. So,
what about fillers, Dr.
yeah,
C?
so for fillers, there are common areas would be under eye. Again, Amira doesn't need much, maybe just a hint of a little bit of a dark shadow there. So that's called a tear trough. We can fill that in. For older patients, you get deep lines here, which are known as the nasolabial lines and the marionette lines. We can fill that in with filler. Again, it's an optional procedure, but some people like lip volume enhancement. So we can fill in the lip area as well. And for other older patients, sometimes you need to give cheek volume as well, which we do. And sometimes on the jawline, to enhance the jawline. So these are common areas for fillers.
Very good. Thanks, Dr. Salid. Thank you, Amira. Thanks a lot.
Well, right from the time that I chose surgery as a specialty, we go through rotations, and I really found my calling in the plastic surgery rotation, which is just in the second year of residency. But I couldn't look beyond it. I feel or felt at that point that it's how it differentiates itself from other specialties in surgery is that there's so much of positivity about it. Well, to the general public, I would say that this is something which is not just about vanity, or it should not be considered superficial. In many cases, clearly the reconstructive side, there is no debate about it, but the aesthetic side of it, it's not just about looks, it's about function. It's also about your own self-esteem, about your body image, and it makes a huge difference if there's something that has been bothering you and has been bringing your self-esteem down. There's a simple solution to it. All these surgeries are designed to be simple. They're 1 or 2 days maximum admissions in the hospital, and you can have the result that you've always wanted, and then carry on upwards and forwards in life.
Every week at Health Hub, our team brings you the most interesting and intriguing information related to your health. I'm Dr. Khawla, and I'll see you next week. Stay safe.